Hey, welcome to Mama Do. Hope you're doing well. Today I'm going to talk about pregnancy and labour with MS. So MS in general shouldn't have any effect at all on you becoming pregnant. I asked my neurologist before I started any MS medication whether it was a good idea, whether MS would have a massive impact on pregnancy or conceiving, and she said no. She said if it's something that you want to do, then carry on with your life as you've planned. So the only thing that she did say to me was that I couldn't have any DMTs, or there's some medication that you can't have prior to getting pregnant and during your pregnancy. So if you are thinking about trying for a baby and you're already on any DMTs or MS medication, just ask your neurologist, ask your GP whether that medication is going to interfere, because there are some medications that aren't recommended for people who are trying to get pregnant or people who are already pregnant. Also, people who are breastfeeding, there's some medication that's not recommended there, and that goes for males and females. Sometimes the medication that males have can impact the pregnancy with the journey of conception. But other than that, she said to me, completely go ahead as normal. So I put off the medication that I was about to start, because she said to me that if I had a certain medication, I would have to then come off that medication for a certain period of time before I could start trying for a baby. So my husband and I decided to just wait until we were ready and then try for a baby and then have medication afterwards. So I used an app called Ovia, and you can get that on iOS and Android. It's a really well made, well thought out app, and you just put all your details in there like you would on a normal menstrual cycle app, and it'll tell you your most fertile days, your ovulation window, and everything in between, your predicted kind of menstrual cycle, etc. And we were lucky enough to fall pregnant within the first 2 months of using that app. Now obviously I'm not going to say that it was due to that app that we got pregnant so quick. I think we were just lucky, but it really did help identify those windows of time which were going to be best for conception. In terms of pregnancy with MS, to be honest, there was no symptoms whatsoever MS related. So all my residual symptoms that I've got from previous relapses completely disappeared. I know it's not like that for everybody. There's different people with MS that I've spoken to where they continue to have their normal symptoms, or they do unfortunately have relapses during pregnancy, but it's quite rare. And my symptoms completely disappeared. So my muscle stiffness, my weakness, my chronic fatigue, my headaches, all of those things completely disappeared. The only symptoms that I got were what I call normal pregnancy symptoms. So things like nausea, heartburn, and general tiredness, but not the fatigue that I have, just general tiredness of, you know, not being able to sleep when the baby gets a little bit bigger and you're a bit uncomfortable. So yeah, so all my symptoms completely disappeared. I was so lucky and grateful about that. I had the entire time of my pregnancy MS symptom free, and I did joke about it with my husband, saying maybe the key to not having any MS symptoms whatsoever is to just continually stay pregnant. But I wouldn't do that, because I've got an absolute menace now. He's a wonderful, lovable menace, but I don't think that I could deal with multiple of the same personality. So pregnancy was absolutely fine. I had the normal nausea that some people get in the beginning, so that lasted from about, say, 8 weeks to maybe 14 to 16 weeks. That kind of went away after that time, and then the rest of my pregnancy was completely symptom free. I did have some complications with the cord, so the umbilical cord, but that was nothing MS related. That's just something that sometimes happens where there was the oxygen levels are monitored on your scans, on the ultrasound scans that you have, and they just continue to monitor that. They had me back in every week for a scan and just monitored that cord to make sure everything was fine, and it was fine. I think due to that, when I was getting up to I think it was 37 or 38th week, they said to me, do you want to come in for an induction? Because of the complications with that cord, they kind of decided that there was no point kind of leaving it any further. Baby was fully developed, fully healthy, and they decided to offer me to come in to get induced. The induction process is strange, uncomfortable, and it did work for me. I know some people don't have success in the short time span that I had success with it. There was a lady who was next to me being induced, and she'd already been in there for 2 days, and she was going into a 3rd day when I was going down to the labour suite. So I went in the morning, and then they induced me with this hormone. So the induction process it's kind of like a little bit of really thin, kind of plasticky cardboard type of thing with a really long kind of cotton tail on it, and that gets pushed right up to where your cervix is, and then the medication that's surrounding that piece of plastic kind of dissipates into your body and helps your body kind of say, right, okay, it's time to go now. And so that kind of helped within 24 hours, so I was really lucky. Having the induction was super uncomfortable because obviously you're getting poked and prodded everywhere, and it really did start the contractions moving. Contractions for me, how can I describe them? So you've got a combination, or what I felt anyway, a combination of period pain. That's kind of the worst period you've ever had, with those kind of pulsing, uncomfortable around the sides of your tummy lower down. And also, you know, when you've got a really bad tummy with something you've eaten or something like that, it's combined with that sort of uncomfortable feeling. And it kind of comes in waves. In the beginning, the waves are longer, so you'll have a longer gap in between these waves, but the waves kind of seem to last a longer period of time, and they come on gradually and then go off gradually. They get to a peak and then go off gradually. And I was like that all night until the next morning. Then my husband came back because he wasn't allowed to stay with me, unfortunately, and we were just about to get some lunch because I was absolutely starving, and then one of the midwives came and said, right, okay, let's get you down to the delivery suite. So the one thing that I would recommend anybody ask if you're a first-time mum and you've never given birth before is, when you get into that delivery suite, ask them how the bed comes apart, because I was so nervous from different videos that I'd watched and other people's labour experiences that I didn't want to give birth on my back. I was dead against it, didn't want to give birth on my back. And I know that you can sit up on your knees, and I tried that and it didn't work for me. It was really uncomfortable. But ask how the bed comes apart, because that bed is like a transformer. I don't know how they've got it to do what it does, but the whole bottom end of the bed comes off, so it kind of turns into a chair that has a little bit of a bottom so you can kind of sit on it, but the rest of the front of the bed just completely disassembles. It comes off. So when you're kind of lay on your back and you're raised up slightly, it's kind of like you're sat in a chair with your legs up, and it's actually super comfortable. Definitely when you get into the labour suite, if it's your first time, you've never seen one of these beds come apart before, ask them, how does that bed come apart? In terms of labour and delivery, the only things that I had, apart from the obvious contractions and pain, was a little bit of nausea, and I think that was to do with the adrenaline and pain running through my entire body. And they gave me an anti-sickness injection in my leg, which kind of solved that, got rid of that. I was sick a couple of times, but it was nothing horrendous. It was just, you know, being sick, it's not very nice to do. I did have gas and air. I didn't personally like it. I don't think it did anything much for me other than make me feel like I was a little bit drunk, and I don't particularly like that feeling. But it does work for some people. It helped. One thing it did help me with is my breathing, because you have to breathe it in and breathe out in a certain way. It does help you with that rhythmic breathing that you can do, which is really helpful throughout your entire delivery process. I got to a certain point where the pain kind of got, the waves of pains and contractions were pretty overwhelming. But I think, yes, they're overwhelming to begin with, and they're overwhelming all the way through. But I think it's the time span that you're going through that much pain. And I think you just get to a certain point of so many hours that your body just can't physically take any more of it. And I don't know whether that's to do with MS, personal pain threshold. I know that your body as a woman is meant to do that. It's meant to give birth. We're built to give birth. And to people who do this thing without any type of pain relief whatsoever, I take my hats off to you. I really do, because I couldn't do it. We're here as vessels in terms of muscles and a body to house this tiny human being, that you're going to do the physical work to push that baby out. But what you realise when you give birth is that you don't have a choice. You really don't have a choice. Your body, and this is what I didn't realise until I physically gave birth, is that when those contractions come, it's not you that's doing that. It's your body that's doing that for you. And you're just, when you're having those contractions, your body is doing that automatically when it needs to, when it wants to. And your job is to identify what these contractions are, what they mean, and then you then do the physical stuff. You then put your mind in motion to do the physical stuff of pushing or waiting, or pushing or waiting. In the end, it did get so painful that I had to have some pain medication. So I had pethidone, and they injected that, I think, or either put it in a cannula, I can't remember. That was amazing for me. And MS wise, there's nothing that my neurologist said, or the midwife said, or the consultant midwife that was assigned to me through my pregnancy due to MS. There's nothing to say that just because you have MS doesn't mean that you can't have certain pain medications, doesn't mean that you can't have an epidural, doesn't mean that you can't have an anaesthetic, doesn't mean that you can't have a C-section. So all options are available to you if you have MS. It doesn't matter. You can have all the options that someone with MS, someone without MS has. So I had pethidone, and I would recommend that in terms of pain relief, but please be aware that for me anyway, it didn't take away all the pain. And I'm almost glad about that, because it allowed me to still feel when my body was contracting. It still allowed me to feel when my body wanted me to do something, wanted me to push. I did get to a stage towards the end where I turned around and said to my husband, I'm not going to be able to do this without an epidural. I think, like I said before, that's time related, and the amount of time that I was in consistent pain for, I think my mind just got to the end of its tether and kind of my mind was telling me I can't go on, I can't do this anymore. So they got the tray with all the stuff ready to do the epidural, and then I was just waiting for the anaesthetist because she was with somebody else. And this may or may not happen to you, and don't get disheartened if what happens to you is the same as me. And I'm almost glad for it in one way. So before your epidural, they have to check how many centimetres dilated you are. So they got all this stuff out on the table, waiting for the anaesthetist, and they checked how many centimetres I was, and I was dilated to exactly 10 centimetres. So I was told, unfortunately, because you're 10 centimetres, you can't have an epidural. So I was absolutely gutted at the time. My heart absolutely sank, and I just thought to myself, how in the hell am I going to continue to do this, and how much longer is it going to take? I don't know how much longer it took, because I just sat back and I just concentrated on going through the motions of contraction after contraction after contraction. I had hypnobirthing before I went into labour. I had about, I think it was 4 sessions in the middle of my pregnancy. I would recommend that massively. It helps you get to grips in your brain about what is actually going to happen with your body, and how you see that mentally, and how you're able to help your body to be able to get this baby out, and also to help you understand that the pain that you're going through is normal. In terms of the pethidone, it allowed me in between contractions to almost drift off, even if that was for a few seconds or a couple of minutes, and that really helped. And looking back, I can't even imagine going to sleep in between those contractions and in between so much pain, but I did. And if you get the chance to just relax, if you've got someone with you who's going to support you through that delivery, that's so important to have someone there that's going to support you, because you can then sit and relax. I know I'm saying relax, it's painful, but relax as much as possible, knowing that that other person who you've brought in that room to support you will take care of everything else. So we came to the point where the midwife said to me, okay, it's time to push. And I kind of knew that it was time to push, because I'd watched so many birthing videos. A lot of people say don't watch birthing videos because it's going to scare you. And one of my midwives said to me, don't watch birthing videos because it will just scare you and it will make you apprehensive. But to be honest, I think the more you read, the more you watch, the more you learn. And the more you learn, the more you're equipped with information-wise when you're in a similar situation. So I would say go out there, do your research, do reading, watch loads of videos. If you watch One Born Every Minute that's aired in the UK, it's a good programme to watch, but please bear in mind that it's not like that. They make it a very airy-fairy kind of way of showing labour and delivery. So just be aware that it's not like what's on the TV programme. There's lots of videos on YouTube of real labour, real births, and they're probably the best ones to watch, because it does give you the raw real information to watch. Anyway, on one of the programmes, or a couple of the programmes and videos that I watched about delivery, I also knew it was time to push, because I turned to my husband and I said that classic phrase, apparently, I think I need a poo. So apparently that phrase, when you get to the point where in your mind you think to yourself, I think I need a poo, that's translated into midwife talk as, I'm going to have a baby. So there we were. I was lay on my back at the time, kind of raised up, and one midwife came in and from a different room, and she said, "Do you know what? Let's get you onto your side." I was absolutely bricking myself at that point, because I thought, there is no way in the world that you're going to get me from on my back to on my side. Baby's head is so low down in my pelvis that everything was so tight that I just couldn't move. But I did it. I suppose in your mind you think to yourself, how am I going to do that? But eventually you put your mind to it, you do it. So they turned me on my side. That miraculously almost threw, it was almost like it threw a switch in my body, and he started to really come down the birthing canal. And then I came back onto my back, and they'll probably ask you to grip your hands around the back of your thighs and pull up, because that helps the root of the baby through the birthing canal. And I don't know how long that took, because it's all a bit fuzzy, especially after 16 months. But I remember on the second to last time that I pushed, I really did think to myself, bearing in mind that almost 12 hours had gone, I really did think to myself, I am not physically not capable of doing this. I cannot. I have no more energy to give with pushing. And the midwife told me to stop on one of my pushes, so I stopped. Sometimes you think that's going to be really difficult if you've never given birth before, but it's actually okay. I thought it was going to be difficult when they said stop pushing, but you do stop. And they get you to stop and push and stop and push, because they can see the head. They guide you with this to stop you from tearing. So I came to what was going to be my final push, and in my mind, because the last push was so difficult for me energy wise, I don't know what happened in my brain, but I said to myself, this is literally going to be the last time that I push. I'm going to put everything into this. And I literally just pulled my legs back and put my chin to my chest and just took the deepest breath I've ever taken and pushed with all my might. And there it was, born. Perfectly healthy, 5 fingers, 5 toes, everything in place, perfect baby boy. I did tear, so I didn't have an episiotomy. So an episiotomy is where they will cut you, and I didn't have that, but I did tear, unfortunately, in certain areas. Only small tears, but I think I had about 8 in total, just in different areas. They put the baby on me to start with for 10 minutes or so, and then they took him away to put him under the little incubator light to keep him warm and to check him over. And then a lady came in to stitch those little tears up. And I don't know whether I was lucky, because there were little tears in lots of different areas, but I didn't feel her. I felt like a tiny little kind of prickling sensation, but I didn't really feel that much in terms of her putting stitches in me. And I think that's just due to the trauma that area goes through when you're giving birth, and it's quite swollen and quite bruised. So I didn't really feel those stitches are going in. So if you're worried about that, honestly, from my experience, don't be at all. After that happened, I forgot to tell you about the placenta. So in terms of whether you've got MS or you haven't got MS, you can have the decision whether to have an injection which helps the placenta from detaching from your uterus. So you don't have to have it. You can allow that placenta to come off naturally. There are some risks of having the placenta detach from your uterus naturally. It does take quite an elongated amount of time, and it can not detach properly from your uterus wall, and that can cause a bleed. But obviously you've got midwives and doctors around you, so you should be absolutely fine. I chose to have an injection, so they just put that medication into either the cannula or in my leg, and that allowed the placenta to come away from my uterus wall quite quickly, and then they just kind of gave a little tug on the umbilical cord, which I didn't feel, and the placenta came out, and I didn't feel the placenta coming out either. After all that was done, I think, from what I remember, that was it, all done. They gave me some pads from the hospital, because of obviously when you give birth, you've got all excess blood, and you might bleed for a month, 2 months, 3 months after. It's different with every single person, and it is quite heavy to begin with, and then it will peter off. But if you're concerned, obviously, always call your GP. It's really important that anything to do with bleeding, or if you don't think that something is right with your body after you've given birth, call the GP, or if it's serious, obviously, call emergency services. But they gave me a pad, and that was it. Told me to get dressed, and then they wheeled in a trolley, which I was so grateful for, with a cup of tea and some toast. I didn't really want anything like big meal wise, but in terms of energy, a cup of tea and a couple of slices of toast, I was just so glad to see that tray with something to eat and something to drink, because I didn't get my lunch before I gave birth, so I had literally no food the entire time. I know that some people say to take snacks with you, and I did. I had a huge bag of snacks, and if I'm honest, I didn't really want any. I think I was just so embroiled in with the pain of the contractions and thirst that I didn't really want any food. But at that moment in time, when they wheeled that trolley in, I was so thankful that I had a cup of tea and a piece of toast. And then they just give you time to get your baby dressed and in a blanket with a little hat on, the little mitts on, and then they'll wheel you up to the other ward where you'll sit for a while and rest, and then they'll give you some food, give you some water, a cup of tea or whatever you want, and go through checks with the baby and go through checks with you, and also help you to breastfeed if you want to. There's a lactation consultant that came round to me, and they showed you exactly what to do, and I was amazed really how quickly baby just took to it. And I know that I was fortunate with that. I know that a lot of people struggle with breastfeeding, and sometimes it does take time, and when I got home it took more time than it did in the hospital. I think it's because I was on my own and I didn't have the help of a lactation consultant that was there. But he took to it after a couple of days, and everything was absolutely fine. In terms of MS relapses after you're pregnant, so when you become pregnant, your hormones, the balance of hormones in your body are not as they were. The balance of hormones change because you are pregnant. They change because they need to protect the baby, and neurologists believe that the lessening of MS symptoms and the lessening of MS relapses during pregnancy are due to this balance of hormones. They think it's that, they're not quite sure, but with MS there's a lot of stuff that we're not sure about. And when you give birth, obviously, because you're not pregnant anymore, because you haven't got the placenta, because you haven't got the baby living inside you, those hormones don't need to be as they were. So they will fluctuate and change again to try and get back to the level that they were before you were pregnant. This doesn't happen overnight. This happens in an elongated period. So they do say 9 to 18 months to get back to what you were formerly. Unfortunately, I had a relapse after 6 months of giving birth. So my relapse was, a relapse of a previous relapse that I'd had years ago on my left hand side, and it was okay. It wasn't debilitating, it was okay, it was manageable. My fatigue came back, but then I wasn't sure whether that was my MS fatigue or whether it was fatigue from having a tiny baby, because let's not forget, having a tiny baby, the sleep deprivation is there already. So yeah, 6 months in, I had a relapse. And a lot of people, from speaking to other MS sufferers, their relapses, if they do relapse after pregnancy, happen between 5 months and a year. So just watch out for changes in your body anyway due to pregnancy, due to the bleeding. Just watch out for any changes that you might see and report them to your GP. Ask your health visitor whether they think that it's normal. It's really important to keep check on your body. Also keep aware of your body for relapses, because we all know that if you think that you're going to be going into a relapse, because you can identify them quite soon before they peak and then peter off, depending on how bad that relapse is. But if you feel like, even if it doesn't turn into one, if you feel like you're having a relapse, call your MS nurse, call your GP, whoever you normally call when you're relapsing, and let them know, because they can help you with different things to help hold that relapse back, or to help it not get as worse as it would do without any intervention. You might only have one relapse, you might have no relapses whatsoever. I had a relapse at 6 months. I had a different relapse at about 9 months, and I continued having relapses in different areas of my body up to just after 12 months, and then it kind of petered off. I didn't have anything else then up until my recent one, which was about 13 months after giving birth, and that was quite a debilitating relapse. I've got a video about it which I'll link below. And that was on my right hand side, so I've never really had anything on my right hand side before, but it was quite a big relapse, and I had to go and have IV steroids for that to try and halt it in its tracks and try and help my body recover for it to peter out and get better. In terms of if you do relapse, just check with your GP, check with your neurologist, check with your MS nurse what type of medication that you can have, because if you're still breastfeeding, you just want to be careful about what you're taking, what you're consuming into your body. But in terms of pregnancy, in terms of delivery, in terms of labour, when you have MS, in my experience, not as bad as what I thought. I thought that my symptoms were going to get worse, and they didn't. They got better, fortunately. Do consider any medication that you are currently on if you're not pregnant. Do consider any medication that you're on currently if you are pregnant. Do consider medication that your partner is on if he or she is pregnant, because this may affect the baby via conception and during your pregnancy and through breastfeeding as well. Talk everything through with your neurologist. If you're thinking about having a baby, if you're pregnant, if you're breastfeeding, if you're wanting to breastfeed, anything to do with that surrounding topic, talk to your MS nurse, talk to your GP, talk to your neurologist. You can talk to your midwife, but she's not going to know enough about MS to reassure you in what questions you have. Please speak to your MS team. I'm sure that they will say to you exactly the same as they said to me, in terms of, if you want to have a baby, go and live your life, because there is absolutely nothing evidence-based that should stop you from conceiving, that should halt your pregnancy, that should give you any other complications that other people without MS have. And delivery should be as other people's delivery without MS too. If you do have any further questions about MS, pregnancy, conception, delivery, or if there's anything that you feel that I've left out of this video, I do get cog fog quite bad, do get brain fog quite bad. That's why you kind of probably see me looking up in the air and saying a lot, because I just forget sometimes, and 1 minute it's in and 1 minute it disappears. So if there's anything you think that you want to ask, or anything that you think that I haven't spoken about on the video that you would like me to either answer or like me to do a video about, comment below, send me an email, and I'll happily answer those personally, or if you want me to do a video, I'll do one. But remember to like if this video was good for you. Remember to subscribe, remember to click the little bell so you get alerted when all the new videos come up. So yeah, stay healthy, see you next time.